Kaya, Nunquell, Michael Mitchell. Hello, I'm Michael Mitchell, and I currently work for myself as a consultant in the field of social and emotional wellbeing and Aboriginal mental health. I'm considered by many to be a subject matter expert in the field of Aboriginal mental health and social and emotional wellbeing. Nija Nyunga Buja, Nyang Yang and Wajak Mort Budias. This is Nyunga country. I pay respect to the local Wajak custodians and elders. In this video, I'll help you navigate the Manual of Resources. You can find the Manual of Resources on our homepage. These resources were developed by or with Aboriginal and Torres Strait Islander people. Most are published by Indigenous organisations, with some mainstream organisations included if there is clear evidence of appropriate co-design with Indigenous people. The resources in this manual address the full spectrum of suicide prevention, from protecting and building up wellbeing and resilience, through responding to distress and crisis, to postvention and supporting people who have lost someone to suicide. If you are looking for resources for your clients or patients, then this section provides guidance on culturally responsive support, including information on responsiveness, video resources for clinicians demonstrating culturally safe consultations, and self-care resources for Indigenous practitioners. It applies to the suicide prevention, social and emotional wellbeing and mental health workforces. You can search the manual by the filters such as cultural understanding and respect or staying safe and well. There are a multitude of different categories and options to explore and access. You can also find not just written information, but also video, audio and multimedia resources. Now let's go back to the homepage and I will direct you to the Primary Health Networks or PHS and funding section. This section of the manual was originally created for the primary health networks, helping them to commission suicide prevention services for Indigenous people in a culturally responsive way. These resources are also valuable for state government agencies, large NGOs and other mainstream organisations that fund services in Indigenous communities. You can jump to different sections based on your needs. For example, if you're looking for tools and checklists to assist in commissioning services that empower Aboriginal and Torres Strait Islander communities, there are interactive tools to help your organisation to identify strengths and any weakness in preparing to commission services for Indigenous people and communities. Each of them links through to a flowchart that can help organisations understand whether they are ready to commission in a culturally responsive way. You can also return to the checklist periodically to monitor the process over time. The manual offers a wide range of functions for you to explore and enjoy. It continues to grow and develop, and we always welcome feedback on how we can improve it. So, what are you waiting for? Now that I've guided you through the fundamentals of the website, it should be a useful tool for any clinicians or frontline workers or funding and commissioning agencies engaging in best practice in Aboriginal and Torres Strait Islander suicide prevention and related fields. Thank you. Aboriginal and Torres Strait Islander people, please be aware that this website may contain images and voices of people who have passed away.